Cameron Mott was 3 years old when the seizures began. Not small ones, not manageable ones. Seizures that lasted hours. Seizures that left her unconscious. Seizures that were slowly destroying her brain, one episode at a time. The diagnosis was Rasmussen's encephalitis, a rare condition in which the immune system attacks one hemisphere of the brain, causing relentless, unstoppable electrical storms. The treatment her doctors proposed was almost unthinkable. Dr. George Jallow, we would remove the entire left hemisphere of her brain. Half of her brain gone. The procedure is called a hemispherectomy. Surgeons disconnect or remove an entire cerebral hemisphere, the left or right half of the brain, as a last resort against catastrophic seizure disorders. The left hemisphere in most people controls language, speech, and movement on the right side of the body. Removing it, conventional wisdom suggested, would leave a child unable to speak, paralyzed on the right side and cognitively devastated. Cameron's parents signed the consent forms, and the surgeons went to work. Cameron's mother, Monica Mott, later recalled, "We were terrified, but we were watching our daughter disappear anyway." Faced with the progressive loss of their daughter, they realized they had no other choice. The seizures stopped immediately, and then something extraordinary began to happen. Cameron's remaining right hemisphere, a hemisphere that had never been responsible for language, began to rewire itself. Slowly, then rapidly, new neural pathways formed. Old functions found new addresses. The brain refused to accept its reduced inventory. Dr. Jallow, within months she was speaking. Within a year she was in school. Her right hemisphere essentially absorbed the functions of the left. We knew this was possible in theory. Watching it happen in a child is still, after all these years, astonishing. Cameron walked with a slight limp. The right side of her body, controlled by the now absent left hemisphere, was somewhat weakened. But she walked, she talked, she laughed, she went to school. Cameron is not alone. Hundreds of children worldwide have undergone hemispherectomy, and the outcomes, especially in young children, are often remarkable. The younger the patient, the more dramatic the recovery. A direct reflection of the brain's extraordinary plasticity in early childhood. Neuroscientist. The brain has a hierarchy of priorities. Survival and function come first. If the usual hardware is gone, it will use whatever hardware remains. It is not graceful about it. It is not instant. But given time and the right environment, it finds a way. For the rest of us, Cameron's story is both humbling and hopeful. If half a brain can learn to do the work of a whole one, then the barriers we place around human potential, based on damage, age, or limitation, may be far less fixed than we imagine. Half a brain, a full life. A story that neuroscientists are still working to fully understand. And that reminds every one of us that the brain's most fundamental drive is not to be whole. It is to keep going.